Mother's Day kicks off National Women's Health Week. So what do you need to tell your mother, your grandmother, daughter, wife, or any special woman in your life about her health? Well, Dr. Assil Saleh is here to discuss very important medical tests that every woman needs to know to live the longest and the healthiest life that she can. Good to have you here, Dr. Saleh.
Great to be here. Thank you very much.
I guess as women, we all tend to kind of be caregivers, don't we? And that often means that we're not thinking about us, we're thinking about everybody else in our life.
That's exactly right. We all have children to take care of, we have family members to take care of, and we always put their health and their well-being first and foremost. But we tend to forget about ourselves, and we're the caregivers. We have to be healthy in order to deliver care and in order to be good to our family members. So this is a great opportunity, national, as you said, National Women's Health Week, to empower women to go out there and try to take care of their health.
And focus on ourselves for a change.
Exactly.
Yeah. So you say that there are some important tests that we all need to have, regular screening tests that we should have to stay healthy.
Yes.
Let's go through them. What's the first test?
Well, there are many out there, but I think if we were to pick five, the five most important ones are actually two of them are cholesterol checks and blood pressure checks. Those are two risk factors for cardiac disease, and women are just as predisposed as men as in developing cardiac disease, developing coronary disease, developing heart attacks that can be deadly.
But I think we're pretty much familiar with the blood pressure, because almost every time you go to a doctor, they stick the thing on your arm. And
Absolutely, absolutely, and you have to do that at least on average once a year, if not once every 2 years or so.
Now the cholesterol test, how's that done?
That's a typical blood test. That's a very simple blood test. You have to go fasting, meaning that you're not supposed to eat or drink 6 to 8 hours prior to the blood test. And it tests a number of cholesterol profiles. There's the cholesterol, the bad cholesterol, or the LDL cholesterol, and then the protective cholesterol, which is the HDL cholesterol. And that really needs to be done starting from age 21 onwards. When you're in your early 20s to 30s, it's done every 5 years. And then when you reach the age of 45, it's done on an annual basis, because that's when people develop hyperlipidemia or high cholesterol.
And I would assume that that blood test would also point to the triglycerides, how much fat is in the blood.
Right. That's exactly
that can be an indicator too, right?
Absolutely, that's exactly right. And you know, some of us have family history, some of us have other predisposing factors such as bad habits and so on. So it's a crucial blood test that surprisingly we pick up a lot of people with high cholesterol levels as early as their 30s.
Okay, those are two tests. Now, what else do you recommend?
Well, of course, as women, we need to take care of our breasts. So breast examinations, self-breast examinations, as well as mammograms. Mammograms are indicated in women between the ages of 40 to 50, starting from that age onwards, and every 1 to 2 years. Now, if you have risk factors, such as a family history of breast cancer, of course, it has to be done much earlier, and you have to be aware of that. You have to educate women so that they can be role models for their children and their daughters and their sisters and so on.
And with the mammogram test, I mean, you can have the regular mammogram, and then there's the digital kind, right? It's a little bit higher quality, isn't it?
Right. You're absolutely right. There are a couple of kinds, and you have to talk to your doctors, to your radiologists, and find out what's suitable for you and what facility you could get them done at. Yes.
And I guess the other female kind of test would be the pap smear.
Yes, absolutely, absolutely. Early detection of cancer, such as breast cancer or cervical cancer, with a pap smear is key towards treating and intervening early and getting rid of the disease. So pap smears starting from age 21 or as soon as you become sexually active, and then when in your 20s, you should really be doing them every 1 to 2 years. The older you get, in your 30s and 40s, maybe every 2 to 3 years. So those are crucial in early detection of cervical cancer, and as I said, the earlier you detect disease, the better the outcome.
Okay, and then I guess as we age, it's important to take care of our bones.
Yes.
Something we may not even think about, right?
Absolutely, absolutely. And you know, we're trying to educate even parents to take care of their children's bone health. So increased calcium, vitamin D in your diet, increase in sun exposure, and so on. But as we grow, we can develop osteoporosis. Particularly women can develop osteoporosis. Men can too. And starting from age 50 onwards, we should really be thinking about getting a bone density scan to establish whether we have developed a thinning of the bone or osteoporosis or the precursor to that, osteopenia. So it's crucial. Checking your vitamin D level also is a great test to get done these days at the doctor's office. Those are crucial things, and you know, if you find that you have osteoporosis or osteopenia, there are many ways of treating those conditions that would prevent future risk of fractures, such as hip fracture or spinal fracture, and so on. So why not take a preventative measure?
Are you talking about taking a medication or something like using weights?
Both, both. So weight-bearing exercises are very crucial in delaying progression of osteopenia to osteoporosis, and medications also. So a number of drugs out there that are very effective in treating and delaying those diseases.
Okay, before we go, how important is it to get a physical exam, and how often do we need those?
That's a great question. We typically advocate that each one of us should get a physical once a year. If you can't, once every 2 years, if you really have to stretch it. But absolutely, once a year. Go to your doctors, run through your medications if you have any, run through your stresses, talk about your mental health, talk about, you know, your routine physical activities, diet, exercising, and so on. So a physical, you know, is really advisable to once a year.
And try to get that relationship going with your doctor,
Absolutely.
right? Be honest, answer the questions.
That's key. That's key.
Dr. Assil Saleh with the Foxhall Internists. It is National Women's Health Week, and we are so glad you could stop by and tell us about those important tests.
Thank you very much.